In 2013, the Ministry of Health issued a set of hospital quality assessment criteria with a strong focus on patients. Many lessons and experiences of the 3-year piloting of the criteria were shared at the third National Hospital Quality Forum, which took place on Thursday and Friday in Hanoi.
The Zoo Hospital in Ho Chi Minh City is well known for the expertise of its doctors. Before the Ministry of Health issued the quality assessment criteria, this hospital hadn't paid much attention to anything other than the quality of the medical treatment.
In the past, when patients arrived at our hospital, we almost always focused on how to treat them, while perhaps neglecting their other needs. Whenever we instructed the patient verbally, we didn't really know whether they understood or not. We didn't really do anything about it either.
Addressing the problem, the Ministry of Health decided to establish a set of quality assessment criteria with 83 points, which are constructed by referencing several sets of hospital quality assessment standards, such as those from the WHO or from the EU. All of them aim for patient satisfaction as the core value.
If one day the director of the hospital finds out that it lacks toilets, seats or public price lists, with these criteria applied, the director must find ways to satisfy all these needs for the patients, alongside upgrading equipment and developing strategic plans for the hospital.
The formation of this quality assessment criteria, with a strong focus on the patients, is also the result of the close cooperation between Vietnam and the EU through the Health Sector Capacity Support Project.
What we have been doing here on quality management over the last 3 years is we have developed guidelines and standards on best practices for hospitals at the central level. Then we have promoted the use of these guidelines and implementation over all the hospitals in the 63 provinces. And we have developed systems to monitor and to develop an inspection so that we can see if the guidelines are properly implemented.
At the conference, many experiences and practice from hospitals nationwide was also discussed.
With a team in charge of customer services, when patients arrive or their family members have any queries, we provide answers through text messaging, TV screens or leaflet, or even personal consulting.
For the past 3 years, the Ministry of Health's quality assessment criteria have been piloted at 13 hospitals at various levels around Vietnam. With this criteria, the ministry hopes that every patient can enjoy better services at hospitals and regain the trust of the people in the country's healthcare services. Thái Tân, Vietnam Television, Hanoi.